Chào mừng quý vị khán giả đã quay trở lại với chuỗi thứ 5 của chương trình tư vấn di truyền thảo luận cùng chuyên gia của Trung tâm Tư vấn Di truyền 𝐬𝐧𝐡. Đây là chuỗi chương trình trao đổi kiến thức y khoa của Trung tâm Tư vấn Di truyền 𝐬𝐧𝐡 được phát sóng trên cái fanpage chính thức của 𝐬𝐬𝐡 với mong muốn cung cấp các kiến thức về y khoa một cách đa dạng và hữu ích tới toàn bộ tất cả các bác sĩ và những chuyên gia, những sinh viên ngành y và khách hàng quan tâm đến lĩnh vực này. Tôi là Đinh Thị Quỳnh Ngọc, làm nhân viên của Trung tâm Tư vấn Di truyền và phòng R&D của 𝐬𝐬𝐡. Quý vị thân mến, trong bối cảnh y học hiện đại, các xét nghiệm di truyền đang ngày càng đóng một vai trò quan trọng trong việc hỗ trợ sinh sản. Các phương pháp xét nghiệm gen và di truyền mới không chỉ mang đến cơ hội sinh con khỏe mạnh cho những gia đình có tiền sử bệnh lý di truyền mà còn giúp tăng khả năng thành công của các phương pháp thụ tinh nhân tạo là IVF. Từ việc phát hiện sớm các bất thường di truyền, việc lựa chọn những cái phôi khỏe mạnh cho đến các cái việc như tư vấn và lựa chọn điều trị. Những cái tiến bộ ngày nay đã mang lại những hy vọng rất nhiều cho các gia đình và mở ra một tương lai sinh sản một cách vững chắc hơn. Chủ đề của talk show lần này của chúng ta là ứng dụng các xét nghiệm gen và di truyền mới trong hỗ trợ sinh sản trên thế giới và thực tiễn tại châu Âu. Ngày hôm nay thì chúng ta có một sự đồng hành vô cùng đặc biệt, mang đến những cái thông tin hữu ích và quan trọng. Xin trân trọng giới thiệu với quý vị khán giả, chuyên gia sẽ đồng hành cùng chúng ta ngày hôm nay là Phó Giáo sư Tiến sĩ Francesca Spinella. Cô là chuyên viên thông tin y khoa cao cấp của Eurofins Genoma, chủ tịch của 𝐓𝐑𝐔𝐘𝐄 Consortium. Phó giáo sư tiến sĩ Francesca đã có nhiều năm kinh nghiệm tham gia vào lĩnh vực sinh sản, đặc biệt là trong xét nghiệm di truyền trước chuyển phôi là PGT test. Và bà cũng đã tham gia tích cực vào việc phát triển các cái quy thuật mới nhằm cải thiện tỷ lệ thành công của điều trị thụ tinh trong ống nghiệm IVF. Phó giáo sư tiến sĩ Francesca cũng là một chuyên gia được công nhận trong lĩnh vực di truyền trước sinh và cô đã đóng góp vào sự phát triển của một số kỹ thuật đã trở thành chuẩn mực trong lĩnh vực này. Xin chào giáo sư Francesca. Let us now greeting Associate Professor Dr. Francesca Spinella. We are delighted to have her on our show today. And thank you, Dr. Francesca, for accepting our invitation for participate in our talk show by 𝐬𝐬𝐡. Could you please send a greeting for our audience?
Thank you very much for having me on this talk show by 𝐬𝐬𝐡. It is a pleasure to be here. I would like to extend my warming greetings to everyone watching the live stream, and I am very excited to share insight on emerge in a meaningful discussion with you all. So thank you for tuning me in.
Thank you, professors, for taking your valuable time to join us today. And especially, I think that you can share the useful knowledge for our doctors who are directly practicing in this field, the assisted reproduction field in Vietnam. From the initial insight shared by our experts, I believe everyone can see the practical significance of our today's talk show. Please share and interact with our online talk show more. People can access valuable information. So now we will go into the discussions about the specialized in the assisted reproduction. And as we have known, PGT as known as pre-implantation genetic testing is an important test in the field of assisted reproduction. So, professors, could you briefly introduce PGT technique, especially advanced one, currently applied in Europe as well as in all over the world?
Of course, thank you for the question. Actually, pre-implantation genetic testing is very crucial tool for IVF. And because it can give us the opportunity to identify chromosomic and genetic alteration in the embryo before to transfer the embryo in the uterus. Actually, we have 3 different types of pre-implantation genetic testing. The one is called PGT-A, because it's a pre-implantation genetic testing for aneuploidy. This means that during the analysis it's possible to identify the presence of chromosomal abnormalities, such as the presence of a single chromosome or the presence of 3 chromosomes instead of 2, that are the normal number of copies. So in the presence of 3 chromosomes, we are, for example, the presence of a trisomy. So, for example, the one that is responsible for the Down syndrome. So in this case, we can know about the chromosomal constitution of our embryos. The other kind of PGT is PGTM, for monogenic disease. In this case, it is possible to identify the presence of genetic alteration that are carriers from parents, for example, and in this case, avoid to transmit the same genetic disease in the embryos. Another kind of PGT is PGT for structural rearrangement, PGT-SR. Again, this kind of PGT is able to identify the presence of structural rearrangement that are often associated with the yes, the embryo in this case are unable to implant and leading to a pregnancy. So also in this case we can detect this kind of abnormality. The new emerging technology right now I want to mention two of these that are the non-invasive pre-implantation genetic testing and PGT for ploidy. Non-invasive pre-implantation genetic testing give us the possibility to test the embryo without embryo biopsy. So from analyzing the cell-free DNA present in the medium. But while this NIPT, this non-invasive PGT is very promising, actually there are many, we need other additional study. And in Europe, there are many studies that are conducting right now that are involving the clinical application and also clinical evaluation of the test. The other methodology that are now emerging and it seems very promising, and I saw that many doctors are interested, especially embryologists, are PGT for polyploidy. So in this case, the PGT is able to identify the presence of abnormal chromosome in embryo, but specific kind of abnormality that are the presence of haploidy or polyploidy. This means that in this case, the chromosomal embryo is present only in one copy, haploid, or present in 3 copy or 4 copy for all the chromosome in the embryo. This is, of course, is an abnormal situation, and in this case, the embryo is not able to progress, to develop, and often is the cause of miscarriage. This kind of situation is very common in the zygote, in which is present only one nuclear PN. Sorry, and or is present the zygote is developed in let's say in not normal way, so present for example 3 PN or 4 PN. In this case, it's very probably that the chromosomically aspect of the embryo is a polyploidy. So with this technology that's called PGT Next or PGT for ploidy, it's possible to identify such situations. So the presence of 3 chromosomes for each chromosome in the embryo, avoiding the transfer of this embryo. But there is another advantage of this technology. For example, if a zygote presents 1 PN or 3 PN and is able to develop in a blastocyte, we can check if this blastocyte is indeed a polyploid, with a polyploid aspect. So we can check if the 3 PN, so the abnormal zygote, is really abnormal, because sometimes this the zygote with 3 PN can develop in a euploid embryo. So we can rescue, in this case, some of these embryos. So this represents an opportunity to implement the number of viable embryo for transfer. And this kind of analysis is always performed together with PGT-A for aneuploidy, because we need to check these two situations that can be checked only by these two different approach. So PGT-A for aneuploidy and PGT PGT polyploidy for polyploidy. So when we do this, we are more sure that our embryo is free from this kind of abnormalities.
Yeah. We can see that there are many cutting-edge techniques we apply for PGT testing. So from your point of view, do you think what are the considerations in genetic counseling for this kind of test?
Of course, the genetic counseling is very important for this, for IVF and for PGT in general. For IVF, because we know how the patient feeling during during this kind of treatment. So, of course, if you are performing PGT for both, for aneuploidy or for structural enlargement, as well as PGT for this new emerging test, so for polyploidy, it is very important to talk with the patient to explain what the technology is able to detect and what is the risk for this treatment, the different scenario that the patients could have. So during the pre-counseling, the patients need to know which technology are using and which are the risks and which are the possible outcome after the PGT analysis. And of course, it's very important to spend also several times for patients, because the patients need to have time to understand, because these concepts are very difficult for patients to understand. The gene, the chromosome are something that maybe they never hear before. So it's important to have time to dedicate to patients, and also, of course, be very relaxed with the patients and help the patient to understand. After the result, so post-counseling test is again very important, maybe much more difficult, because if you need to explain the patients that all the embryo are unavailable for transfer because are unemployed or affected, this situation is much more critical. So you need again to have time to explain the patient, explain what means aneuploidy, what means transfer an aneuploid embryo or polyploid embryo, and also explain that such embryo have no opportunity to develop or can be at risk to give a baby with the genetic defect. So it's very important to explain all the situation to the patients and offer, of course, an opportunity that they can choose if they don't have any other chance, of course. So this is very important. Part of the treatment, let's say. So genetic counseling is part of the IVF treatment.
Yes. And with your experience in the mosaic embryo research, what criteria should be used to prioritize mosaic embryos for implantation?
Thank you for this question. Actually, this is a very important question, yes, and a challenging question, because let's say that mosaicism is a pretty new knowledge, because of course this is a common phenomenon, but since 10 years that we know, since the introduction of new technologies such as NGS, that we are able to increase the resolution of our test, our PGT. Now we can understand that there is also a situation in which embryo are not all euploid. Not all the cells in the embryo are euploid, or not all the cells in the embryo are aneuploid, but there is a situation in between. So there is a situation in which embryos are composed by euploid and aneuploid cells. This is possible to detect this situation only with this new technology, so the NGS-based PGT. And right now we know that this kind of embryo have the potential to implant and lead to a healthy baby. But until 10 years ago, this kind of embryo were considered completely aneuploid and deselected for the transfer. Now, after 2015, when was demonstrated that indeed that this embryo are available, part of this embryo are, have the potential to develop in healthy baby. Now many IVF centers are proposing the transfer of mosaic embryo to those women without euploid available for transfer. Which kind of embryo transfer? Which kind of embryo prioritized? This is very, difficult question. Actually, we are collecting data about the outcome of mosaic embryo, and together with the International Registry of Mosaic Embryo Transfer, 𝐓𝐬𝐿, we are asking IVF center to send the data because we want to collect and give an overview and a guideline to understand which kind of embryo, which kind of mosaic embryo prioritized. Of course, it is important when you evaluate the mosaic embryo, it's important to understand the percentage of aneuploid cell present in the embryo, the type of chromosome alteration that is present, but also the morphology of the embryo. And of course, other parameters related to the patients. So the age, the clinics, the IVF history of the patients. So if it's a first cycle, second cycle, the other. So I want to say that for each patient, it's important to have a different evaluation. So a personalized medicine. This is a case of personalized medicine. So of course, we need to understand the level of mosaicism and type, but also consider the story and the clinical situation of each patient. Regarding specific information, right now we know that from the data that we have, we know that mosaicism with the low level show higher clinical outcome compared to mosaicism with high level. So this means with the embryo containing more aneuploid cells than euploid cells. So it's important to understand which kind of mosaicism level each embryo presents, and also the type of mosaicism, the type of chromosome alteration. So, for example, if it is a complex, so if there are many chromosomic alteration in the embryo, this embryo present a worst outcome compared, for example, to mosaic embryo with only one chromosome involved in alteration. So it's very important to understand the specific characteristic of the embryo to decide the prioritization for transfer.
So we understand that for each patient we will have those other conditions, and we have to focus on many criteria for the implantation. And implantation is a very important procedure. So could you share in Europe in general and particularly in the Genoma IVF centers, how are the pregnant women monitored after performing the PGT testing and embryos transfers?
Okay, thank you for the question. This is very important. Actually, theoretically, after PGT, PGT is considered the first type of, let's say, is compared to a prenatal diagnosis, okay? So once you perform PGT and you have selected the euploid embryo or embryo without the genetic alteration present in the parents, for example, you are pretty sure that the embryo is euploid. he's healthy. But of course, there are, some situations in which alteration, for example, mosaicism, can occur later in the development. Okay, so usually, if you perform PGT and you transfer the euploid embryo, you don't need invasive diagnostic test. Okay, usually, for example, we have many patients performing non-invasive prenatal testing, so NIPT. But in some specific situation, for example, if you are transferring some kind of mosaic embryo, so with a specific type of chromosomic alteration, maybe it's suggested to use to perform prenatal diagnosis, but prenatal diagnosis, not non-invasive PGT. In this case, you need to be sure that the prenatal analysis is performed in cells originated from the fetus, of course. So in this case, it's suggested to use amniocentesis or CVS.
Yes, and according to what you say, I understand that PGT next, the new technique is a comprehensive embryo testing, which have improved the clinical utilities of PGT test for infertile couples. So, when should PGT next be performed?
Okay, PGT next. So for polyploidy detection is important because sometimes when the embryo from patients present alteration in development, for example, as I mentioned before, the pronuclei of the zygote is present in alteration features such as 1 or 3 pronuclei instead of 2. Often these embryo are discarded, are not used for biopsy. So in this case, the number of embryo will be available for transfer will be reduced. So if the patients have, for example, an history of previous embryo with these characteristics, it's very important to suggest to perform this PGTA in combination with PGT for polyploidy, so PGT next directly. So for all blastocytes, also the blastocytes that originate from a zygote with alterated pronuclei, it's possible to perform this test. In this case, you will have a double check of the embryo. You will have not only the analysis for the aneuploidy, but also the embryo will be checked for the presence of haploidy or polyploidy. And in some cases, are rare, but in some cases, also the embryo that have abnormal development, so with the 3PM, can result in diploid, so euploid embryo. So in this case, you can have an increased chance to have more embryo available for transfer. So yes, for these patients with previous embryo with polyploidy, or with pregnant patients with recurrent miscarriage, because we know that miscarriage also are associated with polyploidy. 50% of miscarriage present polyploidy. So it's very important in this case use PGT for polyploidy, so in combination with PGTA, to check also this kind of abnormalities.
Yes, and in Vietnam we have not done the PGT next, but now in Vietnam, especially in genetics, we have been developing an advanced PGT. It's called PGT upgrade. PGT upgrade is a combine of all the cutting-edge techniques from the past PGT testing. However, the application of this testing in Vietnam is still limited because its price is a little bit high compared to average income of Vietnam people. So could you help our audience do a cost-effective analysis of advanced embryo testing for consumer and physician?
Okay, of course, if we this PGT-A and PGT polyploidy are two different tests. So, I mean, it's normal that the price is a little bit higher because you are performing two different kind of tests. And so this to be, as I mentioned before, to double check the embryo. And so the cost is higher. Probably in the next future, the price for this test will decrease. This because, you know, fortunately, this kind of technology evolving very fast. So once the test will become more and more requested, for sure, the company, not the company providing the test like Gentis and the 𝐓𝐿 Genoma, but the company providing the equipment for the test will decrease the price. Yes. So I am sure, as for the PGT in the beginning was very expensive, but with the time the technology evolved, and also the use of this technology now is very spread worldwide. So yes, probably the cost will decrease in the near future.
Yes, we hope that we can expand the PGT testing and make it more popular in all over the world. And please share for us some example that you have benefit from the successful implementation of PGT next in your laboratories.
Yes.
PGT next.
Yes, actually, in 𝐓𝐿 Genoma, we are performing this test. We are offering this test to several clinics in Italy and also in Europe, also outside Europe. We found that, for example, like 10% of embryo with 3PN were indeed deployed. So this, of course, was a very success for us, because we rescued some embryo from the patients, from those obtained from the patients, so the patient have the possibility to transfer this embryo. So right now we are performing PGT for polyploidy in embryo with originated from zygote with only one PN. And also from embryo with 3PN and 3.1 PN. So different abnormality, different pronuclei. And also we use this test to check the embryo that are 2PN, so the embryo that are the normal zygote development, because in some case also 2PN can be polyploid or haploid. This is very important because this can explain, at least in part, why euploid the embryo, so chromosomically normal embryo, does not implant. So this could be an explanation. So for us it's very important to use this kind of test for both, not only for zygote embryo originated from abnormal zygote, but also from embryo originated by normal zygote.
So what are the new testing recently developed in your lab in Europe that can benefit infertile patients?
Thank you for the question. This is a very important point. Actually, we talk until now about pre-implantation genetic testing. This because the implantation of the factor that influence the implantation of an embryo are related, 70% of this factor are related to the chromosomical asset of the embryo. So if the embryo is aneuploid, there are very few chances that the embryo implant. But of course, also some euploid embryo cannot implant. So probably because there are other factors. Indeed, it has been demonstrated that 30% of the characteristic of the implantation are due to specific factor belong to the uterus. So there are specific characteristics of the uterus that can avoid or can impact the transfer of embryo, also even euploid embryo. These are, for example, the windows of implantation. So there are in the uterus there are specific time in which the uterus is available for allowing the attachment of the embryo. So it's very important to understand which is and where is at what time happen this kind of period. So it's important to understand the windows of implantation of each patient. This will give to the doctor the exact moment in which it's better to perform the transfer. So there are several genetic testing that can give us an overview of the situation of the uterus based on the expression profile of specific genes. We can understand when the exact moment of the right period in which to perform the transfer. So this is the receptivity test, analysis test that can be performed. Another test is a test that are investigating the microbiome of the uterus. We know that the microbiome, both in the uterus and also in the vagina, are very important to allow the implantation of the embryo. So this is two factors, the windows of implantation and also the microbiome composition of the uterus are very important because they can have an impact on the implantation potential of embryo. So if we can perform both PGT together with these other two tests, probably we can improve the chance of our patients and improve the IVF outcome.
Yes, and we will have more techniques and advanced testing to apply for IVF procedures. Please tell us in more detail the application of the microbiome test. Could you share more information?
Yes, in this case we can understand which is the composition of microbiome, because there are of course a specific balance between microorganisms that are present in our uterus. So it's important to understand if there are eubiome or a dysbiome in the uterus. So this is very easy. It's a very easy test. Together with is very similar to the test used for detection of the windows of implantation. I mean, is a very small portion of the endometrium is retrieved. So with a biopsy, and this piece of this biopsy is then analyzed for the expression, for gene expression, for example, to identify the windows of implantation, or the same biopsy can be analyzed to identify the microorganisms that are present. So this is a sort of non-invasive test because implies just the biopsy that is performed with a micropipette. So it's not very invasive and relatively easy, and can be combined with also with PGT. So before the cycle in which you need to transfer the embryo, you need to do this kind of test, and then program the next cycle, the transfer of the embryo, based on the result obtained by these two tests.
Yes. And now, before we finish this talk show, could you share us our audience about your feeling when you visit Vietnam, especially visit laboratory mainly about the PGT testing and IVF lab, especially genetics? Could you share some
Yes,
information?
of course. Actually, it was very interesting for me to know about the tests that are performing here in a different hospital in Hanoi. And also the opinion of the doctor for us is very important. It's very important to share this information, and not only for PGT but also for IVF treatment in general. in particular for PGT, had the opportunity to understand the opinion of the doctor here in Hanoi about the mosaic embryo. How they feeling for mosaic embryo. They are concordant that, of course, we need to understand better the clinical outcome of this embryo, but that mosaic embryo can represent a chance for patients without any euploid embryo to transfer. So, and also I receive a very good feeling, good feedback of the doctor about the 𝐓𝐑𝐔𝐘𝐄. For me, it's very important because we belong to the same family that is 𝐓𝐹. Yes. We are networking, so and understand that they are very, the doctor are very satisfied and very happy with the test. Provided by 𝐓𝐑𝐔 for us is a big honor because we know and we want to offer a very good test to all of our patients.
Yeah, thank you so much. And do you think that 𝐓𝐑𝐔 could be improved in the futures and become more better in the futures? And could you suggest us some advice to improve?
Of course, I think that there are many potentiality here. And the technology are evolving very fast, and together with maintaining this networking not only between 𝐓𝐹 entity but also between a scientific community and scientific network, but also with research centers, is very important to grow and also to implement a new technology and to have more and more knowledge about the new tests that can be offered to our patients. I think actually that our collaboration will be very important, not only for the commercial point of view, because we can potentiate our offer for the patients, but the collaboration will be very important for a scientific point of view. Actually, I am a professor at the University 𝐓𝐀𝐋𝐊𝐿 in Rome also, and for us it's very important to bring this knowledge also to the student and let the student grow and understand which is the importance of scientific research and scientific collaboration among centers that perform IVF test.
Yes, and from 𝐓𝐑𝐔 side, from our side, we hope that we will try to get a strong collaboration with Genoma and especially Dr. Francesca in the futures, and hope that we will have the more combined and the more sharing the information about the PGT testing and NIPT testing, and in general is IVF testing. Vâng, thưa quý vị và các bạn, gần như là tất cả những cái quy trình hỗ trợ sinh sản ngày hôm nay bao gồm các chẩn đoán bệnh lý di truyền và phòng ngừa cho thế hệ sau, xác định các chẩn đoán nguyên nhân vô sinh, sảy thai liên tiếp hoặc là hỗ trợ cải thiện sinh sản thì đã được thảo luận trong buổi ngày hôm nay. Và trong suốt quá trình đó thì chúng ta cần có sự phối hợp giữa các bác sĩ lâm sàng và bác sĩ di truyền cũng như là các phòng xét nghiệm di truyền để mang đến cái hiệu quả điều trị tốt nhất cho các gia đình mà đang mong muốn có con. Sự hiểu biết về cơ chế bệnh sinh cũng như là sự phát triển của khoa học công nghệ đã mang đến nhiều xét nghiệm ưu việt ứng dụng trong hỗ trợ sinh sản. Hiện nay thì 𝐓𝐑𝐔 cung cấp đầy đủ tất cả các xét nghiệm di truyền giúp tìm các căn nguyên cho cả nam và nữ, vô sinh hiếm muộn, sàng lọc bất thường di truyền và dự phòng bệnh hiếm cho phôi, tiền làm tổ. Cũng như là những cái hỗ trợ trong quá trình chuyển phôi, theo dõi thai kỳ. Với những cái sự phát triển trong lĩnh vực di truyền và hỗ trợ sinh sản, mong rằng các xét nghiệm gen của 𝐓𝐑𝐔 sẽ giúp ích cho các cặp vợ chồng vô sinh và hiếm muộn. Và chủ đề ứng dụng các xét nghiệm gen và di truyền mới trong hỗ trợ sinh sản trên thế giới và thực tiễn tại châu Âu chắc chắn là đã thu hút được sự chú ý của rất là nhiều chuyên gia và quý vị khán giả. Một lần nữa thì xin cảm ơn Phó giáo sư tiến sĩ Francesca Spinella đã dành thời gian để đồng hành cùng talk show ngày hôm nay. Và nếu còn những thắc mắc về chủ đề này thì xin quý vị khán giả hãy gửi câu hỏi cho chúng tôi tại fanpage Dentist hoặc theo địa chỉ email ở trên màn hình, và để các chuyên gia cùng giải đáp các thắc mắc. Thank you once again. Thank you so much for spending time for us today.
Thank you.
I hope that we will have more talk show like this in the near futures. And cảm ơn quý vị và các bạn rất nhiều.